here we are continuing our presentation on the lymphoid system, and this presentation is going to deal with the spleen. Now, the spleen is the largest lymphoid organ. It's found in the upper left quadrant. It's got a large number of phagocytic cells, and the spleen serves as an in-line filter for blood. It's a site where red blood cells are destroyed. It's also a reservoir for platelets. Now, in some animals, the spleen can serve as a site for red blood cell production. With the exception of the fetal period, this is not the case in humans. The spleen has a capsule of very dense connective tissue that surrounds it, and then trabecula incompletely penetrate the organ, dividing it into compartments. The spleen has an area that we can define as white pulp, and white pulp has areas that we call splenic nodules, sometimes given the term Malpighian bodies. The white pulp of the spleen is the lymphoid tissue in the spleen. We also can define red pulp in the spleen. The red pulp has what we call splenic cords, also given the name cords of Billroth, and these splenic cords lie between the splenic sinusoids. In the red pulp you'll have reticular fibers, red blood cells, white blood cells, macrophages, and lymphocytes. Here, diagrammatically, we just show the spleen with a little bit of a cut here showing the splenic nodules. These areas would represent the red pulp. A little bit higher power view of some of this white pulp. You can see a central artery, and then you can see an area called the periarterial lymphatic sheath around the central artery, marginal zones around the central artery, and then an eccentrically placed lymph nodule. Three main features of the spleen would be the red pulp, the white pulp, and a relatively unusual circulation. So in the diagram, the red pulp would be areas highlighted like this, with a little bit of red stippling around it. The white pulp would be all of this grayish area highlighted like so that I'm tracing with my pointer. And so you can follow the blood supply coming in to the white pulp. Here are the arteries coming in to the white pulp, and these are breaking off into the white pulp, going into the splenic nodules, but then these arteries are opening into sinusoidal spaces in the red pulp, and the diagram shows that some of these arteries enter into sinusoidal spaces, and these sinusoidal spaces are continuous with the venous system. But then on the other hand, here are some arteries coming in out of the white pulp, opening directly into the red pulp. Blood from these arteries is entering into the space of the red pulp, but it's not going directly into the venous system. So we talk about that as open circulation, as opposed to, in this case, where the arteries enter into the sinusoids and the sinusoids enter into the veins, that would be closed circulation. The spleen is a lymphoid organ. Let's talk about that for a second or two. When arteries enter the white pulp parenchyma, they are enveloped by a periarterial lymphatic sheath. So that's what's shown here. Here's a central artery in the white pulp enveloped by this periarterial lymphatic sheath. This pals, if you want, this periarterial lymphatic sheath equals the white pulp. That forms the splenic nodules in association with the central arteries. So here's the nodule here that's a little bit eccentrically placed. Immediately around the central artery in this periarterial lymphatic sheath is where T cells take up residence. And the B cells are in the outer portions of the periarterial lymphatic sheath, away from the central artery. They may be found in this marginal zone, and they're also found within the nodules themselves. So T cells in the periarterial lymphatic sheath right around the central artery, B cells further away from the central artery, and in the eccentrically placed splenic nodule. This diagram just shows at the very tip of the purple arrow, here would be the central artery, and this is the eccentrically placed splenic nodule, if you want. Circulation in the human spleen is rather unusual. As we've implied, there is an open and a closed circulation. So here is a diagram showing this circulation. So what I've got right here would be the white pulp of the spleen with the periarterial lymphatic sheath around the central artery, and here's the central artery coming in. As the central artery is leaving the white pulp, it's subdividing into penicillar arteries, and some of these arteries empty directly into capillaries in the red pulp, and that's what's shown here. And then some of these arteries, as they leave the white pulp, are opening directly into opened space. And this is the unusual feature of circulation in the spleen. Capillaries discharge blood into the splenic sinusoids or directly into the red pulp parenchyma. Open circulation, capillaries open directly into spaces among the reticular cells of splenic cords, and the blood will eventually flow or filter into the venous sinusoids. This open circulation predominates in the human spleen. Probably 80 to 90% of the circulation in the human spleen is in this open circulation. And if you think about this for a minute, there's a very dense connective tissue capsule around the spleen. And think about what happens to a blunt trauma force injury. If you rupture the spleen, say you're in an auto accident and you get hit with the steering wheel, you can rupture the spleen. That can be a very critical situation because you can lose an awful lot of blood awfully fast because of this open circulation within the spleen. In the closed circulation, as the diagram shows, the capillaries are communicating directly with the lumen of the venous sinusoids. This is the cartoon we just showed before, just refreshing for you the closed circulation, like so, versus the open circulation, like so. The red pulp cords, which would be areas like this, contain all of the formed blood cells and macrophages. Here are the splenic sinusoids. So here you've got red cells that are in the red pulp cord. Here you've got red cells in these vessels that are just coming right out of the vessels directly into these pulp cords. And what has to happen is these red cells have to reverse diapedese back into the sinusoidal space. The endothelial cells that line the sinusoids, as depicted in the diagram, are elongated and they run parallel to the lumen of the sinusoids. The basal lamina is discontinuous. There are reticular fibers that loop around the endothelial cells almost at right angles to the sinusoids. And as we said, the open circulation predominates in spleen, so blood that's in these pulp cords has to reverse diapedese into the sinusoids. Now, as we suggested, because of this open circulation, that can have significant clinical consequences. We've already talked about a blunt force trauma injury where you could essentially lose huge blood volumes if the spleen is ruptured, if the dense connective tissue capsule is ruptured. It also poses problems for patients with sickle cell disease because, as you might imagine, sickle cells, the red cells can't change or deform their shape that easily, so you get a lot of sickled cells in the red pulp cords that can't diapedese back into the sinusoids, and this is where the anemia, sickle cell anemia, comes in. The red cells get eliminated in the spleen of sickle cell patients because they can't get back into the circulation in general. Here we're showing diagrammatically a splenic nodule, the white pulp, the periarterial lymphatic sheath, like so. This would be consisting of T cells, B cells in the periphery of the nodule, a nodule here with a germinal center, and then the red pulp with some of these capillaries entering directly into sinusoids, other of these capillaries entering directly into the red pulp cords. If you think about the spleen as a filter for blood, the filtering capacity is as the blood gets out into the open circulation and then has to make its way back into the sinusoids. But the spleen is also a site where tremendous immunologic surveillance occurs, because you're going to have the blood flowing into this open circulation where it's going to be exposed to lymphocytes, macrophages, etc. So the open circulation almost certainly evolved as a highly efficient mechanism to filter blood and as a mechanism for surveillance T cells to monitor foreign antigens in the blood. This is just a low-power histological view of the spleen. We'll show you more images in the laboratory, but very obvious when you look at the spleen in a low-power histological view, you see these nodules. These nodules would be the white pulp. Here you can see a little bit of a trabecular vein. You can see numerous sinusoids at the low power. Here's a little bit higher power of the trabecular vein. You can see some of the splenic sinusoids. Here, a higher power view of the white pulp. You can see the splenic nodule like so, with a germinal center eccentrically placed from the central artery. So if we were looking at this, if I were highlighting right here around the central artery, this would be the area of the periarterial lymphatic sheath, and this is where T cells would take up residence. In the nodule itself and around the periphery of the nodule is where B cells would take up residence.